Hi, welcome back to Surgical Scrubology. My name is Damon. I'm a certified surgical technologist. In today's video, we're discussing OR etiquette. This is part 3 in my series, Back to Basics. If you haven't seen part 1 or 2, that's okay. I'll leave a link for you at the end of this video, so check it out. Now let's get to it. Operating room etiquette is critical for ensuring patient safety, maintaining a sterile environment, and fostering a collaborative team atmosphere. Here are 10 essential aspects of operating room etiquette. Number 1, maintain sterility. Always adhere to strict aseptic techniques. Avoid touching sterile fields such as the back table or a draped patient. Actually, when new people enter the operating room environment, I like to keep it simple and just tell them, don't touch anything surgically blue unless properly scrubbed, gowned, and gloved. Number 2, respect the hierarchy and roles. Acknowledge and respect the roles and responsibilities of all team members, from surgeons to nurses, anesthesiologists, and of course, surgical technologists. Number 3, limit conversations. Keep conversations focused on the procedure and necessary communication only. Unnecessarily talking can be distracting and can introduce contaminants. Number 4, avoid crossing sterile fields. Never walk between sterile fields, for example, between the surgical back table, instrument/implant trays, or already draped patients to prevent contamination. Number 5, prompt and clear communication. Ensure all communication are clear, concise, and timely. If you are unsure about something, ask for clarification immediately. Number 6, be prepared and punctual. Arrive on time, well rested, and prepared for the surgical procedure. Know your role and responsibilities before entering the OR. It is paramount that all active participants and to some degree, observers be familiar with the surgical procedure, anatomy, physiology, and steps to the surgery. Number 7, respect the patient's privacy and dignity. Always be mindful of the patient's privacy both physically and in conversation. Maintain professional behavior at all times. Number 8, proper disposal of sharps. Dispose of needles, blades, and other sharp instruments in designated sharp containers immediately after surgery to avoid injuries. Number 9, minimize movement and noise. Keep movements and noise to a minimum to maintain focus, reduce distractions, and minimize the risk of mistakes and contamination. Number 10, follow OR dress code. Wear the appropriate attire, including scrubs, masks, caps, eye protection, and shoe covers. Ensure all personal items like jewelry, watches, bracelets, and earrings are removed. These are general guidelines to help create a safe and efficient operating room environment, which is crucial for successful surgical outcomes. Now for an added bonus, here are 5 surgical technologist specific OR etiquette guidelines. Number 1, don't touch the mail stand. As a surgical technologist, my responsibility is managing surgical instruments and supplies before, during, and after the surgical procedure. Grabbing items or instruments off the mail stand or returning them back to the mail stand definitely interferes with the efficiency of the surgical procedure. It interrupts the timing and anticipation, so don't do it. Number 2, grab your gloves. If you're not the attending surgeon, please grab your gloves before you scrub, bring them to the surgical technologist or the circulating nurse. Number 3, identify yourself. When entering the operating room as a medical student, resident, PA, fellow, etc., post time out, Always identify yourself to the staff and maybe people who have not worked with you before. Number 4, don't put used sponges on the mail stand. It is very frustrating to have blood-soaked sponges placed on your mail stand during the surgical procedure. This compromises efficiency and cleanliness of the surgical instruments. Number 5, don't stand too close to the back table. If you're not scrubbed and gowned, don't stand too close to the back table. Most surgical technologists prefer that you are at least 1 to 3 feet away from the back table. So there you have it, 10 guidelines for proper OR etiquette. If there's anything in my list that I didn't mention or something that you thought I should add, drop a comment. If you found this content to be useful, please hit the like button. Don't forget to subscribe, and I'll see you soon.